Welcome. I'm Chris Zellers from Rutgers Cooperative Extension of Cape May County. I just want to take a minute and thank the Ocean City Library for having me for this presentation, Making Resolutions for Better Health. And I'd like to thank especially Julie Howard because she's always such a great person to work with and she gets me all set up and scheduled. So thank you, Julie. Thank you, Ocean City Library. Appreciate it. And thank you all for joining me tonight, and Happy New Year. Some of you might have had your New Year's resolutions already started, and some of you might have started them and they've already gone to the wayside. So we're just going to talk a little bit today about making resolutions for better health. And if you haven't made one, might be a good opportunity to kind of set some goals for the new year. And if you have, hopefully this gives you an idea on how to stay on track. So we'll be talking a little bit about both of those topic areas. And Julie and I are commenting on the snow. So I guess it's timely with what we have coming tomorrow, right? So as I mentioned, my name is Chris Zellers, and I'm with Rutgers Cooperative Extension of Cape May County. Rutgers Cooperative Extension is part of the Rutgers, New Jersey Agricultural Experiment Station, and Rutgers University is a land grant university. So that means there's cooperative extension services throughout the state of New Jersey offered by Rutgers Cooperative Extension that support the community with educational information that's scientifically research-based. Rutgers Cooperative Extension is partnership between the Board of County Commissioners, Rutgers, the State University of New Jersey, and the USDA's National Institute of Food and Agriculture. We currently have faculty and or staff in 21 of the 21 New Jersey counties. So Rutgers Cooperative Extension is thriving throughout the state. And we're composed of 3 departments, which include agriculture and natural resources, 4-H youth development, and family and community health sciences, or FCHS. FCHS provides outreach in New Jersey and beyond on topics related to nutrition, chronic disease prevention, food safety, and overall wellness. And at the end of the presentation tonight, I will give you some information on where to find some things on my website. And we have a state website for FCHS as well as a local one here in Cape May County that you can check out information for resources on nutrition and wellness. And we also have social media handles that I'll share with you too. And in accordance with federal law and USDA, U.S. Department of Agriculture, USDA civil rights regulations and policies, this institution is prohibited from discrimination. All right, so let's get started.
Oh, Chris, I'm sorry. Do you want me to do the poll, or was that?
Oh, yes. That was on this slide.
I'm sorry. Okay,
no problem. I appreciate it. You got to keep me on track, Julie.
Okay.
I'm going. Yep. Thank you. Yeah. So Julie's going to release a poll now, and if you would be so kind to fill that out, I'd really appreciate it. Rutgers likes to know that I'm reaching a good portion of the community, so it's important for me to get the feedback from you. So if you could do that, I'd greatly appreciate it. And today's objectives, so we're going to talk a little bit about why health goals are important. I'm calling them health goals because resolutions kind of has a bad connotation, or not a bad one, but they seem like things we let go to the wayside. So we're going to talk about them as goals tonight. And then we're also going to set ourselves up to be successful and find ways to make sure that we can carry out those ideas that we had for making resolutions. And then we're going to make New Year's goals a reality for a lifetime. So ways that we're going to talk about ways that we can, start these things out and realize that they're not a short-term type thing. They're for the long term, because, being healthy isn't just a short-term thing. It's something that we need to keep up with and, work on all the time. Unfortunately, I know it's a lot of work sometimes, but it's worth it in the end. All right. I'd really appreciate it if you tell me what you think. So this is, if you open your smartphones, get your smartphones out and just take open to the camera, hold it up to the screen. You can open up to that QR code and go in. And even if you just answer the first 2 questions, that would be wonderful. And you can fill out at the end. I've added a place for your name and your email address to be entered into a drawing to win a prize if you are selected. So I'm going to be pulling some people out to win a prize that complete the survey. So if you would be so kind to do that, I'd greatly appreciate it. I'll also put this up at the end. So if you didn't get a chance to scan it, then I'll give it to you at the end so you can do it. All right. So let's talk a little bit about making resolutions for better health. And as you look at making a resolution for better health, try not to focus on how you look on the outside, but think about ways that good health can make you feel better, ways that can make you work, feel better at work, feel better overall personally, and even play better. So, we work hard all week long, but we don't want to be so tired on the weekends. We want to be able to play hard too. So think about ways that it's not just your physical appearance, but things that it can make you feel better overall. Good health can contribute to better quality of life now and even as we age. It can lower healthcare costs and copays. So if we're in good health and we're not having to go to the doctors all the time, we won't have those copays and those health care costs. And making a resolution to have better health goals could also lead to a better sense of well-being or improved mental health. And it could provide better mobility and ability to care for yourself as you age. This so far 2024 has not been good to me. I've been sick twice already. I never get sick, but I've been sick twice. And that's really, I can feel it weighing on my mental health so far this season, in the new year. So I think it's important to remember that our physical health can really help with our mental health too. So just something to keep in mind that, it's another good reason to be physically healthy, so that we're also emotionally and mentally healthy. Overall, it could just make you feel better to be healthy, and it could also allow you to lead your best life. So there are important reasons. I always say to myself, I want to have a good quality of life as I age. I don't, it's good to live a long time too, but you want to be able to be out there and doing things that you love. As you age and be in good enough health that you can do that. So think of benefits as you set goals in the new year, rather than trying to quickly change something about yourself that may have taken years to develop. Think about, how you can do stuff for the long term. In other words, make goals that make you feel better, not resolutions that make you feel defeated and unwell. We're going to talk a little bit about ways to keep goals for a lifetime of good health and ways to set goals that make them obtainable too. It's important to make sure that what you're doing is something that you can strive to achieve, and not something that's outlandish, because then it's going to be hard to do that. No matter what your goal is, keeping physical, mental, and emotional health in the forefront can be good motivation as your adventure through the task of starting a new habit begins. Health goals like exercising, eating healthy, and meditating can help reduce the chances of developing chronic disease like diabetes, cancer, and heart disease. And these health changes could lead to a better night's sleep. They found they're still studying whether or not chronic disease leads to lack of sleep, or lack of sleep leads to chronic disease. They're not sure which came first, the horse or the cart on that one. But having a better night's sleep, that makes you feel better overall. I think we can all attest to that when you wake up and you had a good night's sleep. So, making these positive health changes or goals could lead to that better night's sleep. They could give you a better sense of well-being and motivation to continue making healthful changes in your life. So you might start with one small step and then realize the benefit of that. It's important to recognize that, realize that benefit, and then move on to the next step to keeping that going. Goals like healthy relationships and being organized might not seem like things that can support your physical and mental health, but they can. So even though you might say, I was on a call with the national board that I'm on, and we were all talking about our New Year's resolutions, and a couple people said, I want to get more organized. And that being more organized, that gives you the ability to have better mental health. I always say, oh my gosh, there's so much stuff in here. It's fighting with the voices in my head, because I have a lot going on up here. So if there's a lot of chaos around me, even at my desk at work, then that can bring my mental health down. So you want to make sure that when you're setting a goal, like even if it's being organized, like that might seem like it's not really impacting your physical and mental health, but it is. So there's all kinds of good resolutions or goals to set that can positively impact your overall health. I think it's important to realize that a healthy state of mind or healthy mind is just as important as a healthy heart. So when you think about goals to set, think about, like I said, those things that, maybe add clutter to what you're thinking in your mind. And maybe that organization is a good one for you to come up with. So let's talk about sticking with it and focusing on success. The reason we often don't keep New Year's resolutions is because the goals are really too lofty or too unrealistic. Sometimes we have good intentions and we're ambitious with our goals. It's a new year. We want to get out and we want to do this. It's an awesome idea. And then reality sinks in. We get back, the holidays drift away. We get back to our work and family obligations. And the forefront of our lives. And it's really good intentions, but we fall back into bad routines because we haven't set ourselves up to be successful. And that is really why a lot of resolutions fail. So the first thing you want to remember about setting new goals is small steps. I use this example all the time. People a lot of times will say, I want to lose weight. And that's a fine goal to have. But you have to remember that, you didn't always put the weight on in a week or two. So taking it off in a week or two might not be so realistic. So be realistic with your goals and think about how you can maybe break those goals down into smaller steps. Taking small steps means making your goals reasonable. Setting out to run a marathon will take time, and it's going to take training and it's going to take perseverance. So if you are not currently exercising, a long-term goal might be to run, to start out running a couple days a week or something like that. But you need to start small and work your way up to those greater distances, and not immediately think that you're going to be able to go out after not exercising or running and run a marathon. You have to set yourself up for success and make sure that those goals are manageable. Try doing something that fits in your lifestyle first, and that's not going to cause a strain on your professional or personal life. If if something's not manageable, then it's less likely to be obtainable. So, find something that you're likely to stick with and stick with that, so that you can be successful. It's important to seek the love and support from families and friends. If you're taking on a new task, they can help you carry out those small steps and be supportive of you, be a little cheerleader for you, and go, you can do it. But if there's somebody in your life that's not so supportive, you may want to choose not to tell them right away until you get your feet on the ground and you're moving towards that healthy change. You don't want anybody to sabotage your efforts, and everybody knows who those people are. Who the people are in your life that are going to encourage you and support you and in a positive way. So surround yourself with positive people and try to make sure that you can get yourself, the help and support that you need to be successful. Being kind to yourself is probably the most important small step that you can do. Beating yourself up for having an off day is not going to help you. Everybody has an off day. So find ways to be kind to yourself. Like, if you've had a rough day, maybe take a hot bath, go for a walk in nature, read a book, do something that soothes you and makes you feel better, and find ways to reward yourself that doesn't include sabotaging your goals. So for instance, if your goal is to add exercise into your life, then don't skip exercise as a reward because you're trying to make that a positive habit in your life. So rather than skipping the exercise, maybe make plans with a friend after you exercise or exercise together with a friend as a reward so that you have that positive reinforcement. Find ways to create rewards that complement your goals rather than distracting from them or undermining them. And remember, it's okay to have a bad day. If you have a bad day, that's all right. Go back to it the next day. Try to remember why you set the goals, like a better quality of life, and get back on track using those reasons. I always try with exercise. I get up and exercise in the morning. I don't like it. I'll be honest with you. I've taught aerobics and stuff like that for over 25 years. I don't love doing it. However, I know after how I feel, and that positive, I use that as positive reinforcement. Like, it makes me really feel good. It makes me focused. It helps me concentrate. It helps me sleep better. So I do that to try to come up with a positive reinforcement for myself. um and always look at what you've achieved, as you move forward. Don't focus on how far you have left to go. Focus on what you've accomplished already. All right, so for instance, if again, using that exercise example, if you're trying to exercise, say 4 days a week, make that the goal to start with. Okay, I've been exercising for 2 in 2023. I want to exercise for 4 in 2024. So, if you end up only doing 3 days that week, look at the positive, like, oh, wow, I did this. I exercised for 3 days. I did good, and recognize that maybe the next week it'll be 2, but then keep working towards that goal of 4. Staying positive is really important too. And if you need a professional to help you, achieve your goals, then seek it. I'm not saying that you have to spend money, but if it's something that you really are adamant about to connect with your goal, then it might be worth doing that. Your goal might be to start doing yoga, and that might require seeking a professional who teaches beginner yoga, but it doesn't have to. There's plenty of places that you can get videos online on YouTube and whatnot. You can play around with some of them and say, oh, I didn't really like that one, but I like this one. So don't give up. Again, be positive, be, kind to yourself, and find a way to find one that you like. So, like I said, you might need that professional help to get moving on a goal, but, look around, talk to friends, find out where people are doing things. Also, if your goal is to quit smoking, seek help from a professional counselor for a smoking cessation course. That could be another way that you need to get help from a professional. And taking these small little steps will help guarantee your success with your health goals. So you want to make sure that there are things that are obtainable, and that you can, manage throughout with those small steps. When I started off the presentation today, I first started talking about small steps to success. Now, let's talk a little bit about obtaining these goals. So when I was doing nutrition counseling, I often had clients who wanted to lose weight. Obviously, if you're coming to a nutrition counselor, a lot of times it is, to try to lose some weight. Losing weight is certainly a reachable goal, but it's important that making that goal is obtainable. And as I mentioned before, if it took you 10 years to gain 20 pounds, then losing 20 pounds in a month is not going to be a very realistic goal. So try to make sure that you're giving yourself ample amount of time. Usually losing weight in a reasonable way that's going to help you keep it off is usually a pound to maybe pound and a half a week. So think about that as if you're trying to lose weight as one of your goals, that, when you get on the scale, it might only show a pound or a half a pound, or even, a pound over a couple of weeks, because it doesn't come off as easy as we would like it to, unfortunately. Some people can lose 20 pounds in a month, but they might not keep that off, and keep that in mind too. So if you see somebody that lost weight really quickly, it might be something that's not sustainable, because it's not those small steps. And the other thing to remember about weight loss too is that quick weight loss doesn't always mean healthy weight loss. Losing weight by eating and committing to maintain your health for years to come is really a good obtainable way to do that, and fit inside those long-term goals that we're talking about here tonight, and that I mentioned in the beginning of the presentation. Remember that long-term goals, long-term is the good, really the goal to quality health and better quality life. So excuse me, set those obtainable goals for long-term health solutions that can be worked into your daily life forever, not just a month. So I've talked to people, and again, with the nutrition counseling, where they've gone on this really strict diet where they're eliminating things, and that's not sustainable, because our body does need nutrients. So if you're going to, try to lose weight or obtain weight loss, then make sure that you're getting all 5 food groups in, so that you are getting the nutrients that your body needs for sustainable weight loss. A great tool for setting goals is the SMART method, and you might have heard about it. Um, the SMART method can help you stay motivated, and it's good to go back to it. We'll talk about it tonight, but as you're trying to reach your health goals, then think about it, and maybe go back to this method if you're get a little stuck, or aren't feeling motivated. The SMART method was created by George Doran, Arthur Miller, and James Cunningham, and this method of obtaining what you want can be used to support most goals, even though the original model was set up as a management objective model. But it holds true for everything that we do. So as you can see here on the screen, the S stands for specific, M stands for measurable, measured. And again, these are, things we've kind of already touched on a little bit with, making small steps obtainable. The next A is attainable, R is realistic, and T is timely. So again, a lot of the things I already mentioned, but you can say to yourself, it's an easy way to remember this, for keeping these goals, is making sure that it's in this little SMART method. So let's break it down and see which each step, like how you can use this as a method for making yourself successful throughout the year and for years to come, not just now. So first, you want to set a specific goal to stay motivated. So for instance, add one healthy food in a day for the next 6 weeks. If eating healthy is your resolution, the specific goal doesn't need to be extreme. It can be easier to focus in on one thing rather than choosing a big lofty goal that's harder to meet. So taking on too many different goals at once can be overwhelming and hard to stick to. So try to be successful by finding one specific thing to focus on. And again, it doesn't have to be a big thing. Maybe if you're, trying to do a walking regimen, your thing is to walk more, make that, specific thing walking, and then we'll dive in and look at, how, like, maybe measurable. That's the next one, right? So making it measurable, you can say that you're going to do so many days a week as a measure, or you could do it a length of time or a distance as your measure. So again, if you're talking about starting a walking program, you're specific, you want it to be walking, and then you're measuring in some capacity how much you're walking. So make the goal measurable. If you're aiming to drink more water, find a way to measure it, like a certain size container, and how much you have drank. And the goal should be easy to measure. So if you're, setting up measuring, like, I got my water bottle here, I want to drink so many of these a day, number of times you filled it up, and that's something that you can measure, just like with the walking. So it's not hard to set measurable, but again, be reasonable about those measurements. I haven't walked and, I haven't been exercising in 6 years. Don't set yourself up to go out on a 20-mile walk one weekend, because you're probably going to get blisters and sore feet, and you're not really going to want to do it on Monday. So set it up so that it's measurable and that it's realistic. A is the next one, attainable. And you have to remember that your goal needs to be attainable or achievable, and something that you can aspire to do that's relevant to you. If you want to quit smoking, again, that's very achievable, but you may need to seek that professional help to do that. And when you're thinking about walking, if you're setting up that walking goal to start walking all the time, make sure that you're putting an attainable goal on that. It's if you just started this resolution in the beginning of the year, this goal, it's probably been a little bit difficult for you to find the walking here in New Jersey. If you're in New Jersey, it's been a little cold, and we've had a little bit of rain, and we're going to have some snow coming up. So if you're setting yourself up for something that's attainable, you want to make sure that it's something that you can do, that you can start doing and keep doing. So if you want to do the walking thing, just make sure you have clothing that you can get out there in that weather and do, so that it is an attainable goal for you. Next, you want to make sure that your goal is relevant, and it needs to be achievable and something that you can aspire to do that's relevant to you. So your resolution should be individual to you, and what fulfills you. What makes me, complete a health goal is probably different than everybody else on this call. It's going to be different for all of us. We have different motivators. We have different things that make it relevant for us. So make sure to have a resolution that is individual to you, fulfills you, and something that helps you, so that you can find that motivation to keep going. If you're trying to find ways to relax, for instance, and find less stress in your life, then focus more on your overall well-being. Maybe meditation is a relevant goal for you. So create goals that meet your needs for better health. But again, if it's walking, if we're talking about, like, I'm trying to associate like the whole SMART goal in one area, but if you're talking about walking, then it might be relevant for you to go walk in the woods if nature is something that inspires you, or go for a walk on the beach if that's something that inspires you, because that'll help to make that goal more relevant to you, and you can associate with it a little bit better. And then finally, we have T, which is the last one, which set a defined timeline for starting the goal and how it could go, and how long it could go to meet that goal. So remember, the other parts of SMART method, when you set the timeline, for example, the R, realistic. Running a marathon is not realistic if you're not currently exercising. So set that time frame. If you're talking about you do want to run a marathon, then you want to think about what a good timeline is going to be for that. It's probably, if you're just starting out exercising, running a marathon in April is probably going to be pretty difficult. So you want to try to set that. I mean, I'm not saying it's not doable, but you want to try to set that timeline up so that it is, a smart way to do it, and that you're not going to hurt yourself. You're not going to be too sore to continue training. So you're going to want to set a reasonable timeline. Same with, if we go back to that walking idea of, we want to set up a walking program for ourselves, then you're going to want to walk, maybe use that SMART guide with the time portion of it. You're going to maybe want to say, okay, I'm going to start out walking 2 days a week, and then I'm going to bump it up after so many months to 3 days a week. So just set something that, again, is realistic. It's going to stop you from getting hurt, and it's going to be something that helps you fit those SMART goals in there. All right. So as promised, we talked about the health benefits we can achieve by a healthy lifestyle, having those successful, positive ideas in our life about, what's long-term going to help us, and how we can make changes that are long-term versus, just quick and immediate. And now comes the hard part. We all know we want to do things maybe to change and be healthier, but how do we stick with those goals? How do we keep them there for the long term, so that we're in it to win it? So we want to understand the reality of change. And again, it's funny because I think about this all the time. People, I'll be somewhere and people find out what I do or whatever, and they ask me questions. And I think that it kind of comes back to that concept of, the magic bullet, or the fountain of youth, or something like that. People think that there's like this one easy, quick change. And you see the commercials on TV for supplements. I took this supplement, now my memory is better, or I took this supplement. Everybody's always looking for that magic pill or that easy way out. And that's human nature. We want things immediate. We want things quickly, but it's not always, realistic to think in those terms. So really start thinking about like what the reality of change is, and understanding that the hurdles might be in front of us when we're making the healthy goals, and it's imperative to get over those hurdles one at a time. We're not going to jump all the hurdles at once. You go one at a time to be successful. So recognize the change. It's not going to happen overnight, and try to focus on what you have accomplished. This goes back to being positive and kind to yourself. You want to make sure that that the things you are doing, you're recognizing the fact that it could take a little bit of time, and you're in it to win it. You're in it for the long haul. this, you know, I've made changes throughout my life with different things, and it's not been one thing at one time. It's been gradual things. And again, hopefully starting with that one starting point makes you feel good, and you're like, ah, now I'm going to try this. So you can build on it and kind of create those healthy habits. Look at how you're feeling. Does exercising more give you more energy all day long, or does it make you sleep better? And take those little wins each day and be thankful that you have decided to make the healthy change. Realize that, you know, sticking to something and making it a new habit could take 6 weeks or even longer. And remember that a healthy change is not a short-term solution. Rather, it's something that will show results and benefit you for years to come, in keeping with those goals. So stick with it, hang in there. And remember the 6 week thing, I think people, I used to, I've worked at a lot of gyms throughout my life, and, um, you know, people come in on New Year's Day, or, right after New Year's, and they've got the outfits and they're all ready to work out and they're motivated and they're excited. And then usually around, February, you can get a treadmill again because everybody's gone. And then that first nice day, like maybe in February, March, where, it gets a little warmer and people come back again because like, oh my gosh, summer's coming. I gotta get back to my resolution. So it kind of, spurs them again. And then you have those ebb and flows. But you have to remember that making a change, a healthy change, can take that like 6 weeks to do at least. So keep that in mind as you're doing it, because that'll help to motivate you as you go, saying, okay, I've done this for 3 weeks and I'm kind of not loving it, but maybe a couple more weeks and it'll become a normal habit for me, and it'll be something positive. And repetition is good at keeping goals, as well. And if you miss a day, it's okay. Just, get back to it when you can the next day. Try not to make excuses for yourself, and get back in there and do it. You want to try to make a schedule for yourself, but be flexible with yourself. Don't beat yourself up. Some people like to add their goals to their calendar, which is a good way to keep yourself motivated, to set that time aside to achieve that goal. It's, you put meetings on the calendar, and so why not do that? So it's important to do it. And if it's important to you, then set that time aside for you, to be able to do it. Find how the schedule might benefit you and use that as a tool too, to remember that life happens, and that you may need to be a little bit flexible with the schedule and time to be successful, but try to keep with it. A good schedule idea for eating healthy might be to prep salads for the week, a week ahead of time on Sunday or Monday. Maybe use like a glass mason jar or another container that you can chop up all the ingredients to a salad, and have them ready for your lunches. So it's a grab and go. That's going to give you more time in the morning, so you're not so stressed and things like that. So just, little things that can set yourself up, support your new goal, but kind of give you that idea of how it can be more successful, is make it life a little bit easier. And by the way, if you do the salad layer thing in the mason jars, then don't put the salad dressing on until it's time to eat it, or it'll be all mushy. Also, as you progress with your goals, give yourself a lot of love and kindness. Cut the bad self-talk or criticism. Don't think about the way you frame things as you're trying to reach your goals. Are you framing them in a negative way? Like, oh, I missed another day today. I'm just going to hang it up. I'm no good at this. If you're talking negative all the time like that, then you're going to talk yourself out of it. Your mind is going to allow you to talk yourself out of it. Same when you're doing it. If you decided to start running, then set like goals. Okay, I'm running 3 miles today. I'm going to run. The first leg of the journey is to that gazebo. The second leg of the journey is to this, so that you're breaking it down even when you're within it, and think of it positively. All right, I made it to my first marker. All right, I made it to my second marker. I can do this. Now I made it this far. I can turn around and come back. So just, keep thinking about that positive talk. And if you need to, write it down in a journal, talk yourself up so that you see it on the written page, so that you can be kind to yourself and be positive. Think about how you talk to a dear friend or a loved one, and try to encourage them. You probably don't say negative things to them, so don't say negative things to yourself. Turn that self-bashing into love. Get rid of the negative talk, and try to reward yourself with a little positive talk. Also, gratitude journals are really good. I mentioned, writing down the positive so you see it. It's good to see, start your morning out or start some time out that you can write three things that are great about yourself, or three positive things. Like yesterday, my strong legs really helped me. They helped me walk that extra mile. Or something positive to like that, or my kind soul made my child feel better when they were struggling because I was nice to them. Write things down that are positive about yourself to keep that positive reinforcement coming, not just for, these goals, but for overall life positiveness. Everybody's got a positive attribute, so we can find one in there so you can, keep it going. And I think it helps too, because when you start seeing things in that positive mindset, it really helps you to kind of get rid of all that negative, and that's important. And then finally, if things aren't helping, you stay on track, try to find a way to reset yourself. If you've tried all these different things, and you're still struggling with, getting your goals or obtaining your goals, you said, I did the 6-week thing and then I slipped off and it didn't work. I've been positive. You tried all these different things, then try to find a way to reset yourself. There's good meditation sites out there that maybe would help. They're free. They might help you to reset yourself and say, okay, I feel better now. I had some time to think on this. I'll send a list of those out afterwards, but try using meditation to reset yourself. Or, like I said before earlier, try to find that positive thing, like, saying, okay, I want to walk 3 days a week. And when I get to day 2, I'm going to take a nice warm bath and read a book that night as a little reward for myself after I get the kids to bed or something. So just try to find those ways that, you can practice positiveness in your life, and reset if you need to. Sometimes reset might be, going for a walk, or, finding a place that's quiet to, just think of your good intentions, think about the time that you've already put in them to them, or what you want to put into them. Maybe think, okay, Chris said small steps, and I really made a big goal, and maybe this is too big for me right now. So let me reset, make a little bit smaller goal, break it apart, and then I'll go back and make it a bigger long-term goal. Because that might be the case for that too. A little sidebar, I did mention before about, quitting and quitting smoking if you're a smoker. And fortunately here in New Jersey, we have quit centers that are funded by the New Jersey Department of Health. And that you can Google tobacco-free NJ, and they'll come up with the different ones in different areas. I know we have a great one here. Cape Assist does it in Cape May County. Atlantic Prevention does it. Resources does it in Atlantic County. So you have really good local quit centers, and they use counseling and smoking cessation as a smoking cessation tool, and they also use nicotine replacement therapies. So the two together have been research proven to work together. So if you or somebody has this for one of their resolutions, I put it up because I know it's a common resolution. Please look into that and use those resources. They're free resources that we have here in New Jersey. We're very fortunate. So and they also do vaping, quitting for vaping too. So feel free to check them out. And then another resource here, this is the Cape May County Walking Guide. I mentioned walking a couple times throughout the presentation. I put this together, and if you hold your phone up again, you can scan it and it'll pull it up online. We have them in the extension offices. If you want like the physical copy of one, we can mail it to you, or you're welcome to stop by and grab one. But it has all the walking trails in Cape May. So that's a great goal. There's so many cool places in Cape May County to walk. At either ends, we have the boardwalks, we have the woods, we have trails, we have bridges. There's so many great places to walk. So maybe you make you want to be more physically active, or you want to spend more time in the outdoors or something, or explore more of the county. Grab one of the walking guides. You can break it down, like every weekend you can do a different trail or something like that. So there's really cool ones, and I had a lot of fun putting this book together because it really introduced me to a lot of places in the county that I didn't know we had. So it's a fun thing to check out. And it's something you can do all year long. Like this time of year when it's quiet on the barrier islands, you could do those, and then you could switch, to the Belle Plaine or one of those trails out there where it's not so crowded in the summertime. This is again, the scan. If you could please do the questionnaire for me, I'd really appreciate it. And you could just use that on your camera. You can open that. Giving you a lot of QR codes tonight. I also wanted to mention to all of you, the QR code for this to register for this is there. Starting is it next Thursday? My weeks are all off. January 25th. I'm going to start the 8 dimensions of wellness. I have worked on a curriculum with a colleague of mine from the university, and we created a curriculum around the 8 dimensions of wellness. So next week is going to be the introduction, and the 8 dimensions of wellness are based on SAMHSA's 8 dimensions of wellness, and these lessons really, we'll do the introduction and then we break them apart one by one through all the 8 different dimensions of wellness. And, I mentioned a little bit early on about, physical and emotional health, but, there's other facets of being overall having a good sense of well-being. So we touch on all of those and we break them apart, like I said. And what I'm doing for these classes, they'll be from 12:30 to about 1:30, maybe a little less than that. But if you join and then you complete the survey that we send out afterwards, you'll be entered. I'm going to be purchasing at least 10 Fitbits. I think maybe I'm doing 15 Fitbits to give away. So every time you attend a class and then you complete the survey, you'll be entered to win one of those Fitbits. So good opportunity to be involved and also learn a little bit more about how you can make some of these New Year's goals or resolutions a reality, and kind of stay on track with them. Be aware, like we'll cover the one on physical health, and then the emotional one you might say, well, maybe I'm not reaching my physical goals because emotionally I'm not feeling so well. So it'll give you some ideas, some clues and pointers on how to keep being well throughout a lifespan, looking at those different 8 dimensions of wellness. So I invite you all to register for that, and you're welcome to join me, and the chance to win the Fitbit is there. Julie, did you want to release the last poll for me?
Yes,
please?
I'll do that. Yep.
And I also wanted to share this one more opportunity that we have. A colleague of mine, Solja Mather, is she's actually presenting the findings from some of these results in Ireland. She just got accepted to do this because she's got this great program. And it's all about diabetes prevention. So if you know someone that is pre-diabetes or, the family history has diabetes in it, then this is a great program. And they've had wonderful success with it. People that have joined, they've had 100% retention on it, which is really incredible for one of these programs. So they've been doing really well. And it's a 16-week session that you learn new skills on, and then it's followed by 10 bi-weekly or bi-monthly sessions that keep you on track with your goals. So really something that's very important to help prevent diabetes, and a free program that's offered that they do via Zoom. So down here in Cape May County, even though Soldiers up the road in New Jersey, we can have you participate in that. So I encourage you, her email is there. You can reach out to me if you need to, and I can connect you with Solja. I know that they had a waiting list for this. So even if you're thinking, not now, I took too many things on. But if you're looking at, preventing health, you can get on the waiting list, or preventing diabetes, then you can get on the waiting list here. So feel free to reach out if you'd like to inquire more about that or sign up. And if you already have diabetes, unfortunately, this is a pre-diabetes class. So just as I had somebody ask me that one time, so I just wanted to make sure you understand. Okay. And then, as promised, this is my contact information. My website's up there, Facebook pages, and then the FCHS website for the state. We have recipes there, and there's lots of fact sheets, free information, and also on my webpage for Cape May County at FCHS, there's recordings of other videos there. So you can go in and watch other videos that I've done if there's stuff on exercise, eating healthy, sleep, all that kind of stuff. So if there's something that you have for one of your goals for being healthy, then that you might find a video on that to help you out. So, all right. And there are the resources that I used today.